Senator Elizabeth Warren has yet to endorse her candidate and just signed off on the Senate's coronavirus relief plan. And she's joining us live right now from Boston. Hey, Senator.
Hey, how you doing, Whoopi?
I'm good. Now, yesterday, the Senate finally voted to pass the emergency stimulus bill.
Yep.
What are the most important things we need to know about this and how it will help the American people? What's your take on it?
Right. So the number one thing is that it puts more money into testing and makes sure that testing is going to be free for everybody, which is a really important public health. We don't want anybody not to get tested because they're worried that they can't pay for it. So that part's going to be fixed. The other part of this is to start to provide paid sick leave. And I say start because it's a first step. It's important. It recognizes that people who have to count on a paycheck may have to make that call about whether or not to miss that paycheck or go to work when they're not feeling well or when they've got someone at home they need to take care of. And that's not where we want people to be. So this starts by providing some federal money for paid sick leave. The problem is it's just not big enough. It's only covering maybe 1 out of 4 workers and not the other 3 out of 4. So where I'm focused now, I'm glad we voted yesterday, but where I'm focused is on the next package, because this is the one that needs to make sure we've covered ourselves entirely on the healthcare front and that we're starting to make the right kind of response on the economic front. People out of work, businesses shutting down, that part of the fallout from the coronavirus.
Hello, Senator Warren, it's Megan. Thank you for coming on today.
Sure.
Look, there's a lot of anxiety here in New York. The president has been giving us a lot of mixed messages for over a week now, and it's making a lot of us really scared and angry. Here in New York City, we only have 20,000 hospital beds and 10,000 ventilators. We were talking earlier about the mask shortage for nurses and doctors. Trump has given himself a 10 out of 10 for this response to the pandemic. All I can tell you is that there's a lot of people that are really scared in the city right now and don't feel safe and don't feel like we have access to testing. What do you say to people who are feeling really anxious in the city right now because of the poor response from the White House?
So I understand. And look, the president is going to continue to rate himself very highly at a time when his administration and he have failed miserably. But the question is not what's gone wrong, it's what do we do to fix it and what do we do to fix it now. So I'm working hard along with others to push enough federal money out there so that our hospitals at least have the resources to be able to get the supplies they need and to make sure that the CDC and other public health officials can do what they can, commandeer resources, bring those resources in so that people have masks, so that people have protective gear. My focus and my concern is actually on supporting the scientists and the doctors. I'm very worried about the fact that our healthcare professionals are not fully protected, that they don't have the protective gear that they need, because they're putting their lives on the line. They are our front lines. And when our nurses get sick, when our doctors get sick, when the other supporting healthcare professionals get sick, that has effects on all of us. So I think we need an intense focus on making sure they get what they need. The second part is all of us should be following the public health guidelines on self-isolating to the extent possible, watching every part of it, because that at least slows down the number of people who end up catching this and going to the emergency rooms and putting more pressure on our healthcare system. So this is one where we help each other by taking care of ourselves and our children and our parents and making sure that we're neither spreading nor contracting this disease as much as we possibly can.